This is a recording of a presentation I gave at the 7th annual Exploring the Extraordinary Conference at York in December 2015, entitled The Sensitivity Continuum for Mystical and Spiritual Experience. And here is the abstract for this presentation. Scientific and academic investigations into extraordinary experiences have produced an increasing diversity of specialisms and disciplines, as the Exploring the Extraordinary conferences over the past 7 years will testify. Consequently, our knowledge and understanding of anomalous psychic, spiritual, paranormal and supernatural phenomena is expanding in accordance with an expansion in our collective consciousness to accommodate it. However, as we probe deeper into mystical phenomena with our finely tuned methodologies, there is a possibility that we could lose sight of the bigger picture and our ability to apply our knowledge to those problems that are demanding attention by an increasingly strife-ridden modern world. The modern philosopher of science Erwin Laszlo, on the subject of scientific specialization, writes, "The unfortunate consequence of such speciality barriers is that knowledge, instead of being pursued in depth and integrated in breadth, is pursued in depth in isolation. Rather than getting a continuous and coherent picture, we're getting fragments, remarkably detailed but isolated patterns. We're drilling holes in the wall of mystery that we call nature and reality on many different locations, and we carry out delicate analyses on each of the sites. But it's only now that we're beginning to realise the need for connecting the probes with one another and gaining some coherent insight into what is there." Now, Laszlo wrote that in 1996. But connecting the probes, as Laszlo puts it, is precisely what Frederick Myers did when he included clairvoyance, dissociation and all related phenomena within a single conceptual framework that could be explored with the aid of an artificially induced altered state of consciousness. Now, that was back in 1891. So what Laszlo is saying is not new at all. Myers advocated that all human mental experience should be seen on a continuum, and that nothing ought to be regarded as supernatural or paranormal. Myers repeatedly emphasized that such unseen environments that can be accessed through the greater subliminal mind, that's what we call now the subconscious, must somehow be fundamentally continuous and interrelated with the one that we know through our sensory perception. And he says if an unseen world exists, then we must in some sense be in it. Now, I've been guided by Myers' example and applied his epistemological principles in bringing together, through a multidisciplinary approach, mainstream psychological methods with an analysis of altered states of consciousness and externally validated subjective mystical experiences. The result is what I believe to be an integrated model to explain the extraordinary diversity of mystical, spiritual, inspirational, creative, religious and spirit possession experiences. The model may be used to explain why some people believe in paranormal and supernatural phenomena and others do not. It may also be used to explain, hopefully in the easiest to understand terms, why some science disciplines are unable to accommodate spiritual or paranormal phenomena, and why pioneering research into the nature of consciousness is paving the way for a potentially greater understanding of a wide range of anomalous experiences and phenomena. The use of this model has, I believe, enormous potential in practical application of solutions that are forcing politicians and health institutions to re-evaluate how to treat mental illness. Now, in order for me to apply the model to mental health, let me begin with some fundamental facts. Approximately 220,000 people in England and Wales have a diagnosis of schizophrenia. This is published in 2012. In 2007, it accounted for approximately 30% of the total expenditure on adult mental health and social care services. Just in the UK, 5.7 million prescriptions for antipsychotic medications were written in 2005 at a cost of £210.9 million. A further 163,600 long-acting antipsychotic injections were prescribed, costing £5.2 million. Now, globally, the value of psychotropic drugs alone, and that's not including other drugs like antidepressants and so on, but the value of psychotropic drugs alone, globally, the value topped $40 billion, and that was reported in 2008. Now, this presentation seeks to address the relationship between mental health and spirit influence, because I believe that if we can treat mental illness more from a spiritual perspective rather than a pharmaceutical one, we could save millions and reduce the amount of distress in sufferers. So this presentation seeks to address the relationship between mental health and spirit influence, and to open scientific investigation into the efficacy of spiritual interventions as an alternative option to pharmaceuticals and the medical model of mental illness. Now, the continuum model for the sensitivity of spiritual experience, which I will demonstrate in just a moment, enables me to answer a question that I'm often asked, and that is, what percentage of people are influenced by spirit? Now, in order to answer this, let me first apply Frederick Myers' conclusion that all human beings are spirits that occupy or possess a human body. If this assertion is correct, and I do believe it is, then the percentage of the population that are affected by spirit is 100%. And we're affected by spirit in all sorts of different ways. We can be inspired in our thinking by spirit, positively and negatively, and I'll go on to explain this. But for the moment, we have to ask the question, to what extent are we affected or influenced by other spirits, either living, earthbound or discarnate, angelic or demonic? So first we need to acknowledge the validity of evidence from Myers' research and take it at face value that spirits share the ontological status that we all have. Then we can hypothesize on our individual susceptibility to spirit influence according to several factors. For example, are we emotionally sensitive? Are we able to dissociate and enter into an altered state of consciousness? Are we able to consciously alter the energetic frequency of our thoughts? Now there's a thought. Do we have mystical, religious or spiritual experiences at all? Do we hear voices? And so on. So what proportion of health problems are attributed to spirit influence? American psychiatrist Shakuntala Modi analysed a sample of 100 patients who had presented a wide variety of emotional, mental, behavioural and physical problems. Her analysis revealed results that were surprising. 92% were found to have earthbound spirits attached to them. 80 of these patients had more than one spirit, 50 patients had spirits of relatives, and 77 patients had spirits that were described by Modi as demonic, that's non-human. Modi's analysis also revealed that 80% of primary, that's acute symptoms such as depression, anxiety, panic attacks and psychotic symptoms, and 30% of secondary or chronic symptoms such as arthritis, sinusitis, back pain and headaches are caused by spirits, whilst 20% of primary symptoms and 70% of secondary symptoms were caused by past life trauma. Then we have another American psychiatrist, Dr. Edith Fiore, who reported that 75% of her total case load was attributable to spirits. So what factors contribute to the vulnerability of these people who are adversely affected by spirits? Now, the vulnerability model that I'm presenting here has several components, and this is just a selection of many that I could have used. And these are taken from mainstream psychological research, having nothing to do with investigating the spiritual realm. This is mainstream psychology. We have Schaffetter's fragmented ego scale. We have my own idea on reaction to fear stimulus. Then we have Professor Richard Bentl's challenge of the Kraepelinian system. Gordon Claridge of Oxford University, his schizotypal scale. Michael Falborn, the Australian researcher on transliminality and predisposition to enter trance. Michael Heap and his colleagues from Sheffield on hypnotizability scales, and then we look at the positive and negative dimensions, energy frequencies and so on. So let's first have a look at Scharfetter. And here's a graphic representation of Scharfetter's idea. The progression along the continuum from left to right is illustrated by a scale of ego fragmentation. Scharfetter's model enables us to identify how a progressively fragmented personality lends itself to an increasing potential for spirit influence. Now, Scharfetter wasn't talking about spirit influence. Scharfetter's objective was simply to present a model of how the ego, or the personality, fragments along a continuum from healthy mental state to serious mental illness. Scharfetter's ego refers to the experienced identity of the person. And the 100% healthy individual who enjoys a cohesive, integrated personality. Moving one step along the scale, we find a cohesive, integrated personality that's comprised of many personality facets. Each of these facets represents an ego part that has the potential to emerge according to circumstances in the immediate environment that are similar to those that prevailed at the time the ego part responded to external stimuli. Now, I would argue that this is the normal. We are all comprised of a collection of ego parts. Moving along the continuum to the centre represents a loosening of the cohesiveness of the sub-selves, or the ego parts, and the boundaries with the external environment, and these would include people with borderline personality. The next step along the continuum describes a dismantled boundary between the fragmented self and the environment, thereby constituting dissociative identities. Now, with dissociative identity disorder, or what was previously known as multiple personality disorder, you can have Dissociated ego parts that constitute the whole personality, but these parts are not aware of each other. This is a complete loosening of the boundaries. The next step along the continuum describes a dismantled boundary between the fragmented self and the environment, thereby constituting dissociative identities. The fifth and final stage along the continuum denotes a complete fragmentation of the self with no boundary at all between reality and fantasy, and these are possibly diagnosed as schizophrenia. Now, it's my contention that the one significant factor that unites these categories on the continuum is emotion. Now, in chapter 10 of my book, I explored the concept of sympathetic resonance as the predominant factor that attracts spirit entities, positive or negative, to a person who's transmitting a powerful emotional energy. This is, if you like, the law of attraction, or like attracts like. So, Scharfetter's model can be used to illustrate the progressive outcome of an inability to control powerful destructive emotions such as fear, anger, rage, and so on. And it's my contention that fear and the inability to deal with it in an appropriate way is the primary cause of all non-organic mental illness and a highly significant factor in the attraction of negative spirit entities. Because what we found is that there are negative spirit entities that actually feed on fear as a source of energy for their own sustenance. So on the continuum of mental and emotional disorders, anxiety and depression may be seen to represent the thin end of the wedge, progressing in seriousness and intensity through the neuroses to borderline personality disorder, then to DID, and ultimately to schizophrenia at the extreme end of the scale. As the inability to deal with the fear increases, so too does the fragmentation of the ego into subpersonalities, and this renders the individual vulnerable to spirit interference or possession. And here we have progression along the fear continuum: anxiety, panic attacks, phobias and neuroses, borderline personality, bipolar, multiple personality and DID, and the psychoses on the fear reaction continuum. Now, all these scales, for the benefit of people who are not familiar with the statistical tool of psychology, the normal distribution curve, the next slide may provide a very useful image, and here we have an example of the normal distribution curve. At the extreme ends, left and right, you have the few members of the population. In the centre, on the hump, the bell shape, you have the normal population, your Mr. and Mrs. Average, if you like. So Scharfetter, the fear continuum, Bentel and Claridge, schizotypal scales, they all use the normal distribution curve as a tool for measurement. Now, adding support to the concept of the continuum, Richard Bentel challenges the proposition of Emil Kraepelin, who is the original architect of the modern psychiatry diagnostic system, that there are a number of discrete psychiatric disorders, each one associated with a distinct type of brain pathology. Now, Bentel explains how the Kraepelinian model, which has evolved into the modern principle of arriving at a diagnosis based on the identification of presenting symptoms, has been maintained by mainstream psychiatric services. But Bentel argues that the maintenance of the diagnostic system based on symptomology is misleading and actually has no scientific foundation. And the thrust of his argument is extremely well presented and supported by empirical evidence from a diverse array of anthropological, social, psychological and biomedical research. And he explains this in his book Madness Explained, published in 2004. Now, Bentl's observation is a leading indicator that instead of using presenting symptoms for diagnosis, what we should be doing is looking for the original cause of the distress. And as I've outlined earlier, it is my proposition that fear and the inability to deal with it is the cause of mental illness. Now, Richard Bentle worked with Gordon Claridge at Oxford University, where Claridge recognised an apparent continuum, which he called the schizotypal scale, from sanity to insanity, that necessitates a revision of the Kraepelinian model of psychosis. Now, if we look at that distribution curve again, we can put sanity on the extreme end at the left and insanity to the right. So you have a few members, a small number of a given population who are sane, and a small number on the right who are insane. And in the middle are the rest of us, normal. So we all exist on this scale somewhere. So Claridge suggests there's a normal distribution of the predisposition, that's the potential to develop psychosis. And this predisposition can be triggered by environmental events such as psychological or physical trauma that could precipitate a psychotic breakdown. The cause, therefore, according to Claridge, may therefore be emotional or physical trauma. Now, moving on to Michael Falborn, the Australian researcher. Falborn posits the concept of transliminality and sensory sensitivity. Now, here's a good example of a psychologist in creating a word that becomes associated with his own ego, if you like. But what does this mean? And now in chapter 4 of my book, where I examine the methods of modern researchers who research why people believe in the paranormal, I made a note of Falborn's suggestion that transliminality may be a common factor in contributing to why people believe in the paranormal. So transliminality can be seen as a predisposition to dissociate or enter into a trance state or an altered state of consciousness on a progressive scale. So at the extreme end, looking at this distribution curve again, at the extreme left you have people who are unable to enter into an altered state of consciousness. And on the extreme right you have people who do it at the drop of a hat. In the middle are the rest of us, the normal population. We have something of a predisposition potential. Now, Michael Heap and his colleagues up at Sheffield, hypnosis researchers, they produced a book, The Highly Hypnotizable Person, and they collected a total of 13 different hypnotizability scales. On the left of the curve you have people who find it difficult to be hypnotized, and on the right people who find it very, very easy. They found 13 different hypnotizability scales, but the most common ones used are the Stanford scale and the Harvard scale. Now, extrapolating results from the collection of scales in order to arrive at a consensus of hypnotizability is extremely difficult, probably because hypnosis theorists are still unable to accurately define precisely what hypnosis is, and they still appear to be unable to accommodate the idea that the hypnotic state is connected with spirituality, which is what I'm proposing here. Nonetheless, it's suggested that across the general population, the ability to enter into a trance is evenly distributed, with about 20% of the population having the ability to enter into a deep somnambulistic state. Those are the people on the far right. So we have our distribution scales used by all these mainstream psychology researchers, and so far none of them have approached the subject of spirituality. These are all mainstream psychological factors that they're looking at: predisposition to mental illness and predisposition to enter altered states. And I think you can probably see where this is leading us. So now, where do positive and negative dimensions fit? Let's have a look. Now, the French psychiatrist Pierre Janet focused on the negative by his assertion that all those who experience dissociation and psychic phenomena are mentally ill. Now, Frederick Myers and William James did not discount the positive and arrived at a tertium quid approach and the continuum of human experience. Tertium quid meaning there is more than just the two opposing ideas at work here. There's something else at work. Mediumship. And this is where the art and skill of the psychiatrist is tested. It's not sufficient to simply diagnose personality disorders, dissociation, identity, psychosis or schizophrenia, but to consider the very high probability that the cause is spiritual in nature, especially when the symptoms are accompanied by auditory voice intrusions or command hallucinations. So it is here that we're able to distinguish the difference between a healthy-minded spiritualist medium, the positive, and someone who is psychotic. In a study to compare 24 Brazilian spiritist mediums with North American dissociative identity disorder patients, Brazilian scientists, whose names I'm still unable to pronounce properly because they're Portuguese, and I apologise to them for that, they found that in a comparison with DID patients, with the mediums differed in having better social adjustment, lower prevalence of mental disorders, lower use of mental health services, no use of antipsychotics, and lower prevalence of histories of physical or childhood sexual abuse, sleepwalking, secondary features of DID, and symptoms of borderline personality. Thus, they conclude that mediumship differed markedly from dissociative identity in having better mental health and social adjustments and a different clinical profile. Similarly, Kua and colleagues analysed 36 young men who'd been diagnosed with possession trance syndrome, according to DSM. At follow-up 4 to 5 years later, none of the 26 who could be contacted showed any evidence of mental illness. And here is the model. And look at how simple it is. I'd like you to put yourself in the picture, put yourself on this scale as we have a closer look at it. All of the scales that we've discussed so far can be placed on the central line. Increasing intensity from left to right. Scharfetter's ego fragmentation, inability to deal with fear, predisposition to schizoid personality, now that is an ability, the positive, or an uncontrolled disposition, the negative, to enter trance, to dissociate, to be hypnotized. Now, if you're one of those people at the sharp end on the left of the continuum, then you will not be influenced by suggestion or be aware of anything of a discarnate spiritual nature. You will not have mystical experiences, and due to your analytical mind, you will be rational in your explanations as to why others do have such experiences. You may also attribute your flashes of creative inspiration to your own genius, your own subconscious, rather than to any spirit guidance. And here on the left we have your rational, logical, deductive scientist. And this would explain why many scientists are unable to understand or accommodate these ideas. As we move along the continuum, then things do change. We move to the centre of the hump, if you like, on the bell-shaped curve, where most normal people are. We become progressively more vulnerable and more susceptible to the power of suggestion, to creative thinking, and to mystical experiences and spirit influence, and we may experience unexplained synchronicities. As we approach the extreme end of the continuum on the right, those with a robust sense of self will be mediumistic, the positive, and able to control the influence on them from the spirit world. These people will be spiritualist mediums or shaman. But those with a fragmented sense of self, or ego fragmentation according to Scharfesser, together with an inability to deal with strong negative emotions like fear, will be subject to psychosis and negative spirit influence. Simple, isn't it, really? So, using the methods and tools of mainstream psychology, the continuum, the normal distribution curve, and apply it to spiritual experience, we can see that all human experiences exist on a continuum, and this could be correlated, if you like, with the evolution of consciousness. Nothing is supernatural, all is natural, according to the observations of Frederick Myers. And he said nothing is paranormal, it's all normal. We can also use this picture of the curve to identify a spectrum of energy, or light, if you like. The central hump of the curve is the spectrum of our conscious awareness. On the left of the curve you can put infrared spectrum that is beyond our awareness, beyond our vision, and on the right ultraviolet. So we know that we only have a marginal field that we're aware of, and that there are other energies that exist beyond our field of vision. So all human experiences exist on a continuum that can be visualized by the normal distribution curve. Let's assume that at the extreme left of the curve are those who never experience spiritual communication, and the other are those who do, in the middle of the majority of people within the population, who do have some experiences of variable intensity and meaning. Problem is that people who have these experiences rarely report them because they're afraid of being labelled as mentally ill. So Myers declared that nothing is supernatural, all is natural. nothing is paranormal, all is normal. If supernatural experience is on the extreme right of the continuum, then unnatural would be at the other end. If paranormal is at the extreme right of the curve, then abnormal would be at the other end. This would suggest that those who place themselves at the thin end of the wedge, where do you place yourself, are unnatural and abnormal. That's an interesting thought, isn't it? We must therefore step over these epistemological boundaries imposed by the physical sciences in order to accommodate the so-called unnatural and supernatural and the abnormal and paranormal within an expanded natural framework and include everything as normal. Recent research into this area, the Brazilians are leading the way. They're years in front of researchers in the UK and the USA. And in their systematic review of papers indexed on the Medline database on complementary spiritist therapy, Luchetti and colleagues conducted a meta-analysis of spiritist methods of healing, which included disobsession, or what we call spirit release therapy. Of the 49 studies found that were concerned with disobsession, none were included in the meta-analysis due to methodological problems in their design and their inconclusive results. So, even though they're years in front of us, there are still methodological problems that need to be solved. But they hold regular conferences and present their findings to us in the UK. And we need to be able to follow their lead. And here are some research ideas that can be suggested on using Mayer's method of investigation through the subliminal, through the altered state of consciousness. And we can test the efficacy of clairvoyant, that is telepathic diagnosis, as an alternative to just putting a label on presenting symptoms. Clairvoyant telepathic diagnosis can go right to the cause of a problem. And we can investigate whether spirit influence is affecting people convicted with domestic violence and sexual abuse, paedophilia. We have Tourette's syndrome. I've actually had 3 cases of Tourette's syndrome where discarnate spirit entities were found to be interfering with the individual. Then of course we've got dissociative identity or multiple personality and schizophrenia, command hallucinations, addictions, and so on. So the protocol that represents chapter 15 of the book is specifically applied to people with who hear voices, but it could be applied to any of those categories. So my final question is, who will accept the challenge and actually undertake such scientific research in this country? Now, before I finish, I just want to bring to your attention, in fact I've got a few copies of the book here for people who would like a copy, but I want to finish off with a small clip that I've recorded just to illustrate to you the outcome, the results, the distressing, and let me warn you now that this little clip is distressing. This is a video recording of a man who has been adversely affected by spirit entities, and I just want you to bear with me.
Can you see me? Can you see me? Okay, now I've seen
understand what's happening, do something, okay? Right? I'll let you go now. Okay? Good man. Don't worry, good man. We'll get this fixed for you. No problem. Alright? Speak to you soon. So you can see from that clip the man is not at all well. In fact, he couldn't speak. And now let's have some questions. Thank you.